Hello, beautiful people. Thank you for connecting. Welcome back to my channel. Please do not forget to like and subscribe to my channel. So, today being 27th of May, Children's Day, I would like to talk about measles. I'm also dressed in my Hausa dress to show that I am proudly an Ariwa woman. So, we're going to talk about measles. What we need to know about measles is, first of all, what is measles itself, the definition of measles, what are the causes of measles, that's the main cause and also the risk factor. Then, thirdly, you need to know the signs and symptoms, what you will see that it will clearly tell you that this is actually measles. Then, what if it is poorly treated? What will it lead to? It will lead to its complications. So we'll talk about the complication too. Then we will also talk about the stages of measles and also the prevention of measles finally. So, first of all, measles can be said to be a respiratory tract infection. It's also a contagious disease which is caused by rubella virus. Measles is caused mainly by rubella virus, but then the risk factors include when a person is not vaccinated, or when a child, is not vaccinated, when a child is exposed to people having measles also, then when a child is having a poor vitamin A in the system. So all of them are all related to vaccination. Then what are the symptoms of measles? Symptoms of measles varies with the stage. We have the first stage, second and third and fourth stage of measles. The first stage involves the incubation period. The incubation period ranges from 10 to 14 days. This 14 days, it might be asymptomatic. There's no sign or any symptom for you to know. Some usually comes with mild symptoms. Then followed by the second stage, which is the symptomatic stage. The symptomatic stage comes with the full-blown symptoms, ranges from high fever, dry cough, running nose, sore throat, and even eye itching or redness of the eye, that is conjunctivitis. Then it occurs within 3 to 4 days of the onset of measles. Then thirdly, we have the acute illness, which involves the appearance of the spots, that's the Koplik spots, and also the red or pink rashes on the skin. Then we also have the recovery stage, which involves 7 days. After all the first, second, and third stage, it involves like almost 4 to 7 days of recovery, whereby all the symptoms will go down, the fever will go down, the running nose will go down, even the rashes will start drying up and disappearing gradually. So these are the stages and symptoms of measles. Then how can measles be spread? Measles can usually be spread within 4 days before the rashes, that's the active or full-blown measles, or 4 days after the rashes. These are the most complicated signs where a child will be able to transfer it from his own system to another person's system. So how can we prevent this occurrence of measles? The major prevention is through vaccination. So vaccination is very important. We have measles vaccine. So all children should try and be vaccinated with measles vaccination, so that it will reduce their chances of contacting the measles, or even their chances of getting the complication. I spoke about complication. Complication occurs where there is poorly treated measles, or the measles is being ignored without any treatment, both symptomatic and other treatment. So those complications can involve total blindness or permanent blindness and irreversible blindness. This occurs where we said some of the symptoms involve conjunctivitis. So wherever there is conjunctivitis, it might affect the eye lens, thereby leading to permanent blindness. Then secondly, it can also affect the brain, which causes what we call encephalitis. Thirdly, it also causes severe diarrhea and also severe dehydration, whereby the child will have continuous diarrhea non-stop, whereby the child will get dehydrated and even lead to death. Then fourthly, it can lead to ear infection. Ear infection comes as a result of, since the ear, the nose and the throat are connected, it can link from the nose, it can go to the ear and cause some of infections. Then lastly, it can also lead to some severe respiratory tract infection. As we said, measles deals occurs in the nose, which is a respiratory organ, so it can lead to a very severe respiratory tract infection such as pneumonia. So measles is a very serious and contagious disease. Children should be prevented from interacting with other children that are infected, especially in their active stage, so that they will prevent themselves and also prevent those symptoms and complications of measles. Thank you very much. Please do not forget to like and subscribe my channel till we meet next time. Bye bye.